Hello, everyone. Good afternoon. My name is Amir Rand, Physical Therapist, Regional Director here at Spear Physical Therapy. We are just giving a few more minutes to people who are arriving a touch late. We shall be getting started shortly. Hang tight for us. We'll be back soon. All right, let's get started. Like I said earlier, my name is Amir Rand, Physical Therapist, Regional Director here at Spear Physical and Occupational Therapy. I'd like to welcome back those who have attended one of our other webinars and welcome those that are joining us for the first time. Thank you all for choosing to spend the next hour or so with us. And those of you who do not know who we are, Spear is a private outpatient practice, that has been around for about 20 or so years, and we currently have 20 locations located all over New York City and the metro area. Since the pandemic started, we launched Spear Live, which gives you the opportunity to receive PT, that's physical therapy treatment, from the comfort of your own home in a virtual way. It's also worth noting that the vast majority of health insurances have asked us to waive our patients' copays, co-insurances, and deductibles for those telehealth visits. So if you've been putting off PT, now is the time to reach out to us and get back on track. Since the COVID-19 pandemic started, we began noticing a large influx of patients reaching out to us with complaints of both neck and back pain from sitting at their new workstations at home. And our team of clinicians got together and agreed that given today's challenging circumstances, it would be a good idea to provide you all with some tips on how to both prevent and address any symptoms you may be currently experiencing as a result of this new normal. We created today's talk specifically for you and are coming to you live from our own homes. That said, we don't anticipate any technical difficulties today, but please be patient with us as we navigate working through this new technology. As part of our session, we'll be demonstrating some exercises, and we really look forward to you following along and participating. I promise this will not be like any of the typical Zoom meetings you've been participating in. All right, some housekeeping items. Please, if you have questions, we welcome them. We look forward to talking about them at the latter half of today's session. So if you do have questions, please look below at the bottom of your screen. There should be a Q&A feature. That is where you should be placing your questions. There is a chat feature as well, which you can feel free to communicate with us, but we do prefer that you put your questions in the Q&A feature so we can aggregate them for later on. And for you YouTube followers watching us live on YouTube, we are monitoring the comments section as well. So please, If you have a question, feel free to type them there. We are monitoring that. We will address those questions as well. All right, what are we going to be doing today? So first off, we'll be discussing some tactics on how to protect your neck and your jaw while working from home. We'll then shift gears a bit and we'll talk about how to protect your neck and back while lifting, especially heavy items. And then lastly, in my opinion, the most important and the most fun aspect of today, we're going to get you moving. So please participate, get up. We want you feeling better as a result of today's hour session. And the more you participate, the more that becomes a reality. All right, before we get started, let's have our panelists come in and join me. I'd like to introduce you to Rachelle Nguyen and Meghan King. Rachelle comes to us from our 30 Broad Street location down in the financial district. Hey, Rachelle, how's it going? Rachelle is a physical therapist,
hey,
as well as Meghan King, coming from our Murray Hill location. He's a PT as well. Hey, gang. All right. I am going to pass things over to Rachelle. Rachelle's going to be talking to us on how we can protect our neck and jaw while working from home.
All right, everyone. We are going to say goodbye to Amir and Meghan for a little bit, but they'll come back and join us soon. Like Amir said, my name is Rachelle Nguyen. I'm a physical therapist with the Broad Street location, and I am doing a lot of telehealth right now. And I have to say, it has been so much better than any of us anticipated. I really love that I can really see inside my patients' homes, help them set up their computers, their workstations, lift their babies, lift their dogs. And I couldn't do that in the clinic. So this is pretty cool. And even cooler is the fact that most insurances are covering 100% of it. So please, if you need help inside your house, let us know and we'll get you there. Now, if you were with us in the ergonomics lecture last week, welcome back. Good to see you. Today, I want to talk about really more closely in the neck, why the neck and jaw can be so vulnerable to injury when we're working at our computers without a good setup. So if you did this lecture with me last time, it might look familiar, but stay tuned for a couple of more tips because I really want to get into the intricacies of why this is so important. So I'm going to turn my computer so that you can see that I, like you, don't have a bunch of desks around. So you are actually on my only computer, sitting on my only desk. So instead, I got creative and got a bunch of boxes that are holding clothes, and I set them up so I have a two-tiered desk. And the reason I have a two-tiered desk is because I need to have my computer monitor, which is this really nice picture of my mom and my little sister, up at eye level when I'm sitting up straight. And I need to have my keyboard and mouse, which are a Nintendo Switch and a box of mints right now, at my forearm level. When I'm here and I'm able to sit up relatively tall, I'm able to have my neck, my head in a very neutral position. I can hold this position in this neutral for a lot longer without putting a lot of stress through my neck, as opposed to if I had the computer monitor, like a typical laptop down here. In order to really see it, I'd have to be like this all day. Now, this forward head posture is the term we use for this. Forward head posture, which is something very common that we all do when we're working at our laptops all day, when we're sitting at our couch all night, when we're sleeping like this. Forward head posture is not inherently bad, but when we're stuck in this position for anything more than 30 minutes to an hour, it gets really heavy and really hard. A little fact for you is that for every inch your head is forward over your neck, it's an additional 10 pounds of force that goes through the muscles, the joints of your neck. And that 10 pounds, like imagine lifting a gallon of milk out here. You could probably do it for a little while and be totally comfortable with that. But if I asked you to lift a gallon of milk out here for the entirety of your 8-hour workday, you will hate me. Your arm is going to hurt. And even though it's not that extreme, that's what we're doing with our necks when we're down like this. So a laptop itself inherently will not allow you to be ergonomic. So my suggestion, when you have neck pain because you're working at a laptop all day, put your laptop up on something, a box, a bunch of books, soda, some cans, just like literally anything to get it up to eye level. You need to get an external keyboard and mouse to put it down at arm level so your arms can rest on the table and you're not typing up here. And that allows you to bring your head and neck back into this position. So just a little First exercise, I want everyone to participate with me if you're able. We are going to practice a chin tuck, which is one, a movement correction, and two, something you can practice in your spare time just to work on how to get your neck to do what you want it to do to bring your head back into neutral. So I want you to turn to the side with me. First thing you're going to do is just allow your head to be forward in its natural resting position. You don't have to really push it out far like I am, but I'm going to do it extreme so you can see the difference. From here, you are going to sit up tall, allow your shoulders to relax. If your head is still forward, I want you to act like your head is a ball. And instead of rolling the ball down or up, you're going to slide the ball backwards on a table. So it's almost like you're giving yourself double chins. And I'm going to do it really extreme so you can see it. But you don't even really have to go that extreme. As long as you bring it backwards, you bring it this way, you can feel a little bit of a stretch here, maybe a little bit of activation here. This neutral still looks fine, even though it might feel like you're doing this because you're not used to being in this position. So let's do it again. We're all going to lean forward to our natural resting position. From here, I want you to sit up again, and we're going to do 5 chin tucks together. Slide that ball on the table. We're going to go 1 and relax it. 2, relax. 3, relax. 4, relax. 5, relax. And just take a second to see how that feels. See if you feel like you're able to sit up a little bit taller. You didn't do a lot. It's not a lot of muscle activation like going to the gym and lifting, but even just activating the muscles in that way primes your body to be able to hold that position while you're working at home. And just a little reminder for all of our ergonomics people, I don't want you to be in perfect position all day. I want you to take a break, any movement break. Sit like this, stand up, sit down, go get water, go to the bathroom. Every hour that you're working, you're not going to remember, so set a timer. I do my phone because I can't remember to get up because I'm too busy working on everything. But once that timer goes off, I don't care what it is you do, anything, PT exercise, go get water. As long as you're moving, you won't feel quite so tense anymore. And then when you come back to it, you can sit at your good setup. You can have your head in the chin tucked, nice and neutral, and go back to working without worrying about neck pain so much. So what I'm going to do next is I'm going to bring back Meghan, because Meghan and I are both specialists when it comes to jaw and neck pain, especially with referred headaches with all these things. And Meghan is going to talk to us about why so many of us are experiencing more jaw pain now that we're working from home.
Awesome. Thanks, Rachelle. That was awesome. Thank you so much. I 100% am guilty of sitting here looking at the screen like this. And even after
I do it all the time too.
I'm taller. I love the little stretch that it gets kind of right at the base of your skull. Fantastic. So now that we're tall, let's actually real quick take that chin tuck and do a little experiment for people so that now they can kind of understand just a little bit of what it feels like to change that neutral neck position. So, Rachelle, everyone follow along. I'm going to give Rachelle some instructions and just follow along with her. So Rachelle, do me a favor. Pop yourself back into that forward head posture real quick. Good. All right, everyone go along with Rachelle. Find that forward head posture. Good. Now, try to swallow right there. Good. Yeah. You may feel some tightness through here, a little bit of extra work in your jaw, right? It's not the easiest. So
I actually had to like really work my mouth to not dribble the water out.
Yeah, right? Great. So now bring yourself into that nice chin tucked position, that neutral neck posture. Love it. Looks great. Okay, now repeat that. Swallow again. Notice the difference of what you feel.
That was some good water.
So much easier, right? So it's just incredible the difference that little change in neck position makes on how our bodies function. So I hope everyone kind of gets a chance to just feel how much that little shift can change throughout the day. That was great. Perfect. So with that, we're going to segue right into just a little bit of talking about the jaw. It's kind of forgotten about joints sometimes, but as PTs, we do treat the jaw because it's a joint just like any other joint in the body. And it's actually the upstairs neighbor to your neck. So you've got your neck, the next joint up is your jaw, and your jaw is actually located right around here. So some people, since we've started quarantining, working from home, have experienced an increase in pain in their jaw. And a lot of times that is because we are clenching a little bit more these days. Clenching is a natural stress response. And when you clench, a couple of things can happen. Sometimes you'll get that increase in that pain here in your jaw or some tightness, or can affect your neck too, because all these muscles are connected. So that clenching can affect the whole thing. So what Rachelle and I are going to do now is just take a minute to teach you a very simple strategy that you can use anytime throughout your day. It's going to help you just find a little bit more of a relaxed jaw position, relax those muscles, relieve your jaw, relieve your neck. So go ahead and just follow along. I'm going to give Rachelle just a couple of instructions. Go ahead, follow along with her, follow along with me, and just notice the difference in how you feel. So everyone, go ahead. We're going to start. Go ahead and clench your jaw gently, but bring your teeth together and just kind of take note of how that feels. Good. Now, I'm going to follow a very simple set of instructions. So, Rachelle, now what you're going to do is keep your lips together. That's step one. Good. Step two is you're going to relax your jaw muscles. What you're going to find is that your teeth should come a little bit apart so they're not touching anymore. Nice. Look at how much that just relaxes your face there. Excellent. Last step is to take your tongue and just very gently place it on the roof of your mouth, right where your palate meets the back of your front teeth. Just gently place it. Exactly. Good. And right now, that's resting jaw position. How's it feel?
I feel so much better already. Oh my God.
Yeah, it's a huge difference in just that amount of relaxation that you get through your face. So what I really like to encourage people to do is throughout your day, whether you're at your computer, you're going grocery shopping, whatever you're doing, talking on the phone, check in with yourself and see what is your jaw position at that moment. There's a very interesting fact that actually our teeth are never supposed to touch. They don't need to touch when you're eating because there's food. They don't need to touch at rest. So if you check in with yourself during the day and you notice that your teeth are touching, real quick, you're going to think lips together, teeth apart. And you'll bring yourself into that nice resting jaw position and just feel that relaxation. So,
Meghan, that feels so much better.
Good, isn't it great? I catch myself clenching all the time, and it just to feel the amount of tension that we hold in here and just kind of let that rest away.
It's great. I actually, when I did your teeth together, teeth apart, or lips together, teeth apart, I almost feel like I'm hanging with my mouth open like this. Because I'm not used to that relaxation. So it actually helps to have this camera here to show me that my face still looks normal, even though I don't feel normal.
Yes, exactly. It's just a new and different feeling. You look great. You look relaxed. Happy jaw, happy neck. Love it. Fantastic. Well, thank you for demoing that, Rachelle. We're going to say bye-bye, Rachelle, for a few minutes, and I'm going to continue on the conversation. Bye, Rachelle. All right. So now that we've talked about the upstairs neighbor to the neck, which is the jaw, we're going to go to the downstairs neighbor. So we're going to start talking a little bit about shoulders and upper back. In PT, whenever we're addressing neck pain, one of the really, really important things that we do is we strengthen the shoulders, because the shoulder muscles are really the protectors of your neck. So a lot of times what we find is that people tend to kind of flare up their neck or experience an increase in pain a lot of times when they're lifting heavy things, carrying heavy things, just because of the amount of pressure that has the potential to put through your neck. So what we're going to go through today is just a little bit of practice for some lifting technique. This is going to help you out if you're lifting the groceries, the laundry, your dogs, your kids, anything these days at home. This applies to all of it. So what I'm going to ask you to do right now is real quick, just take 5-10 seconds, grab a light object somewhere around the room. Something, a tote bag, a pillow. You want something light because we're going to be practicing a little bit of lifting. So go ahead, take 5-10 seconds, just grab something you can use to practice. And then we're going to work on our lifting technique together. All right. Perfect. So I have my shopping bag here at the ready, my Trader Joe's bag. Perfect. You got your thing ready to go. So first, first, what we're going to start with is a little demo of actually poor lifting technique. We're going to just real quick talk about some of the things that can put increased pressure through your neck. So you already may be catching on to some of these things as we've been talking about them. But what you'll see, and I'm going to demo a poor lift for you, and feel free to try it yourself. And just be careful because it's a poor lifting technique. Use something really light if you're going to try this. Poor lifting technique. There are three kind of hallmarks of this. What we're going to see is forward head, rounded shoulders, and that load is far from your body. So go ahead and check this out. Let me give you a little demo of that. So here's what that technique is going to look like. So forward head, rounded shoulders. Good. So when I do that, I feel a ton of tension right at the spot where my upper back meets my neck, and then also through my low back. So what we're going to do is let's utilize our bodies a little bit more efficiently so that we can lift those loads without straining our necks and our backs. But before we can do that, we have to learn one more quick exercise. So this is a great one. Again, you can do this anywhere, anytime. It goes well with chin tucks. This exercise is called the scapular squeeze. So here's what it looks like. Simple movement. First, you're going to start in just a nice relaxed position. You'll find that your shoulders come forward a little bit, not unlike a lot of times when we're on the computer. Then what you're going to do is you're going to pull your shoulder blades down and back. So you'll feel an opening across the front of your chest. I tell people, think about tucking your shoulder blades into your opposite back pants pockets. And that's going to really give you that nice down and back shoulder blade movement. So it's a nice down and back. Try to stay relaxed through the top of your shoulders. You should feel that activation right through here. Kind of this mid-shoulder, low shoulder blade region. Those are where your stabilizing muscles are that are going to protect your upper back and your neck. So let's just practice real quick. Let's do 5 good scapular squeezes together. Just holding it for a second or so at the end, just starting to tap into those stability muscles. So we'll just do 5 of those. Your hands can relax on your lap. Good. You should feel that you're getting a little taller as you do this. Good. One more. And that's 5. Excellent. Okay. Now we're ready to lift successfully. So with this, we're going to put together the chin tuck, the scapular squeeze, and then we're going to bring that load closer to our body. So I would love for you to, if you feel comfortable, try this at home with your nice light object, thinking about chin tuck, scapular squeeze, lift with your legs. So here's what that's going to look like. So nice and close to your load. Chin tuck, scap squeeze, and then a lift. And that felt 10 times easier than the first time we did it. You're really feeling your ability to utilize your legs to lift that load, and you just feel so stable through your whole upper body, no stress through the neck. So think about these things anytime you're lifting something around the house, even if it's light, if it's heavy, pull in that chin tuck, that scapular squeeze, get close to that load, and lift it with your legs. And you'll find that it just makes a world of difference. So now that we've lifted our load, got our prize toilet paper, what we're going to do is we're going to hand this
Megan,
over to Rachelle. What's that?
Sorry to interrupt there. We have someone who's just curious about how long they should be holding those scapular squeezes.
Oh, that's a great question. So it can vary. It can be as quick as just 1 second, or if you want to challenge yourself and work that endurance, try holding it for 5 seconds or even 10 seconds as you start to feel like you're getting a little bit stronger. It's one of those things, great, Amir, just getting that nice squeeze. Sometimes you can use it as a reset too. If you're at your computer and you found that you've just kind of fallen into this posture throughout the day, give yourself one good 5-10 second scap squeeze. Just feel that opening. Good, and then go back to what you were doing. And you'll feel a world of difference. That's a great question. And now we're gonna hand it back to Rachelle. So we've lifted our groceries, we've got our prize toilet paper, we're gonna hand this right back over to get it up onto a high shelf. Nice.
Awesome. I needed more toilet paper. Thank you, Megan. All right, we're going to say goodbye to Megan. I'm going to show you how to put this all the way up overhead, okay? So especially because we have been crouched over our computers all the time and we haven't really gotten into all of our good physical therapy exercises to start to feel better. Sometimes when you're trying to put all of your toilet paper, groceries, diapers on the top shelf, not only is it tall because you're in a New York apartment and you have to put things on top of things, but your upper back and your neck is so tight that it's really hard to reach up. So I'm going to show you a bad overhead reach so you can see this. Back it up, got my toilet paper. If I need to put this up on the top shelf, but my shoulders are rounded, my head is forward, go with me, round your shoulders, put your forehead or your head forward, try to lift up high. I can't get higher than this before my arm gets stuck, my neck gets stuck, my back hurts. And if I tried to go higher, I would actually end up lifting with my lower back, which is how so many of us hurt our low backs and our necks when we're trying to put stuff up on the top shelf. So in order to really be able to do that, we really need to be able to allow our upper back to extend backwards and reach up without sacrificing our low backs or our neck trying to get to it. But again, if your upper back is so tight from working like this all the time, that's going to be really hard and you're going to end up overusing your neck and overusing your low back to reach up really high. So the next thing I'm going to show you is a really easy exercise that you can do at home to help open up your upper back. I'm going to use this chair that has a height of a back that comes up to about mid upper back for me. If you don't have a chair like that, or if your chair rolls and you're afraid of falling off, please don't use that. You can do this completely sitting without having to put anything up against your back. It's just a little bit more pressure if you use a chair like this. So now that you've all had a little bit of time to get your chair, what you're going to do is you're going to sit up tall. I want you to put your hands behind your head. So I'm going to keep turning my head so you can hear me, but really you're going to keep looking forward the whole time. Hands behind your head, interlace your fingers, just so that you can protect your neck and you don't need to like throw your neck back for all of this, because again, we're protecting our necks for all this. From here, put the chair on your upper back and use that chair to hinge backwards and feel an upper back stretch to the ceiling. Oh my God, that feels so much better already. From here, you can even add in a twist. You can turn to one side. Hi. You can turn to the other side. Then you come back up where you were, and then you come back up again. And as you do that, because your hands are there protecting your neck and you're not throwing just your neck back, you really get more isolation in your upper back and not in your neck. So let's do just 3 simple backwards with rotations together right now. Everyone sit up in your chair while you're sitting. I did it first with the chair, so now I'm going to do it without the chair. Just going to pretend like that's there. Hands behind your head. I want you to reach up, up, up. Your breastbone goes up to the ceiling. Your neck is still in a good neutral, but you're feeling a good stretch in your upper back. From there, you rotate one direction, back up, rotate the other direction. And then you allow yourself to sit up nice and tall. Again, you're not pulling at your neck to do that, like you're pulling for crunches. This is just to allow your neck to rest. Oh, that felt good. 2 more times, we're going to do it continuously. Now, ready? Hands behind your head, arch back, turn to the side, up to the ceiling, turn to the other side, up to the ceiling, back up tall. Good. Ready? Last one. Reach all the way back, turn to one side, up, other side, up, and relax. Oh, now take a moment, put your arms down, breathe in nice and deep. Now from there, add in that little bit of chin tuck, add in that very gentle scap squeeze that Megan taught us. Do you feel like you just grew 3 inches? Because I do. I'm pretty short, so I need 3 inches. And with all of that, now that your upper back feels better, take whatever you're holding around you, a book, your phone, something. I want you to reach up to the top shelf, allow your upper back to arch a little bit like you did. Your core stays nice and neutral. You're not going through your low back. You're not going through your head. My shoulder feels so much better. My neck feels so much better. And to be honest, my upper back feels a lot better because it's been really tight because I've been sitting at this computer all day getting ready for this webinar. So I feel a lot better, and I hope you do too. I'm gonna put my toilet paper down now, and I want to bring back all of our panelists so that we can take some Q&A, because I see a lot of good Q&A in here.
All right, excellent job, ladies. Excellent. I hope everyone was participating and feels a little bit looser. Yeah, you were right, Rachelle. We have a ton of questions. There were several questions about whether we'll be recording and or having this available at a later date. The answer is yes. We will have that for you. It'll be on YouTube. So if you need to review it there, you can. Right, so let's jump ahead into our questions. All right, let's see here. So we've got a question here about a chair. So what does the type of chair you use cause back pain? What kind of support in a chair should I look for if I have chronic upper back pain? Rachelle, you want to take that one?
Yeah, sure. So I wish I could give you a very specific answer, but a lot of it depends on you personally. So for example, I've had a lot of chronic upper back, neck, and jaw pain, and I use different chairs at different points of the day, depending on what I'm doing. Sometimes having a chair like this, very simple wooden chair, nothing expensive or ergonomic, but it has a slightly higher back and it's rigid, so it's not gonna like lean back when I'm sitting on it, is really helpful, so that as I'm sitting in it, my upper back is a bit more supported and I don't have to work so hard to lift it. But sometimes sitting on this gets really annoying. So I'll get like a stool when I'm working with patients and I have to use my muscles to sit up tall as I'm doing that. And then again, sometimes I've been sitting for so much that my neck hurts no matter where I sit, and I actually have to stand and do my work standing, in which case you can set up your computer monitor on a bunch of books, on a countertop, something like that. It's hard, in my opinion, to get one chair that's gonna fix everything, because even though you spend most of your time in that chair, even if you don't leave your chair, like the best chair in the whole dang universe, you're gonna hurt. So I think it's important to not only evaluate how the chair is supporting your back, but how your feet reach the floor. Like if you have to lean forward this way for your feet to touch the floor, maybe you're short like me and you don't reach, you're gonna end up in this rounded position anyway. I put books underneath my feet sometimes so that I can sit up straighter. So unfortunately, I'm gonna go with IDK, but we're gonna figure it out, because a lot of it depends on how your body fits in your space with your computer and your desk. But those are the good tips you can start with. Back support, maybe like upper mid back, feet on the floor without having to slouch, and please get up at least once an hour, if not once every half hour. Set an alarm, use a Google, like a Fitbit watch, just something to move around, because when your upper back hurts, it doesn't matter if you're really, really perfect posture all day. There is no perfect posture. It's gonna hurt no matter where you are, unless you're moving more frequently.
Thank you, Rachelle. That's great.
You're welcome.
I have two questions here that I want to address. I just don't feel comfortable giving an answer to these two. So one, it says, my neck is so weak from a herniated disc, I don't feel I can sit without something behind my head and neck. So how do I fix this? Look, I just want to be careful here. If you've got a history of a herniated disc, I'd be just a little weary to give you advice without having evaluated you first. So my advice to you or anyone, which with another question that sort of goes hand in hand with buzzing or tingling or any kind of radiating sensation down your arm that comes from your neck, I would certainly tell you to reach out to one of us. You know, we can evaluate you and then give you a prescription of exercises that make the most sense. But just to give you a cookie cutter answer, I just don't feel like that'll serve you best. So I hope you can follow that advice well. Let's go to another question here. Okay, I work with a laptop, maybe you could take this one, Megan, and have a riser so that it is at eye level. Is it bad to type with my arms up without a wireless keyboard? I feel like it makes me sit up better when my arms are raised to type.
That is an excellent question. And you've touched on what so many people are finding as the double-edged sword of trying to use a laptop these days. It's either higher up, and so your arms are way up here and you find that you're getting really tight right through your upper traps, holding everything up, or you put it low and now your neck is down. So there's really no perfect way to situate a laptop, because either way, you're going to be sacrificing either your head position or you're going to have to bring your arms way up. So what we really recommend for people is, if you can, order yourself an external keyboard, because what that will allow you to do is, just like Rachelle showed us at the beginning, where you can put your laptop up on exactly some books, some sort of riser to where you can bring your screen up to eye level. Exactly. And then plug in that external keyboard. So then that can come down, because when you're typing, you want to have your shoulders relaxed and your elbows at 90 degrees, just like Rachelle is right now. You can see that's going to be physically impossible to do on a laptop. So if you can, the best way to go is get yourself an external keyboard, especially if you're spending long hours typing. It's going to make your body so much happier.
Awesome. Great advice. I love that. Yeah, let's keep it going. We have so many here. Someone had a question about lifting. So this is for you, Megan. Someone wanted to know, should you curve your back while lifting?
Good question. So there's no one perfect position that your back needs to be in, but let me just show you kind of a super quick demo of what you can be thinking about. So let me just move my computer back over again. So when you lift with a load way out in front of you, what you'll find is the only possible way that you can lift that load is by pulling with your back. So watch this. Here, the only way I can get this up is I have to pull through here. May have a curve in your back, you may not, but either way, you're pulling with all those back muscles. So what I tell people is, the best thing that you can do is to just get closer to that load and allow yourself to use your legs more. And your back is going to just find its natural happy position, and then your legs are going to do the work. So that's going to look very different. So close to the load, you're here. You may have a little arch, but you'll notice that that lift now comes from the legs. And your back is totally off the hook, regardless of having to think about exactly what position it's in. So that's an excellent question. Just really think about, get close to that load and lift with your legs, and that's what's going to protect your low back.
Yeah, actually, Megan, I have a 10-month-old who just learned how to crawl and pull up on things and generally get herself in trouble when I'm across the room. And so when I bend down to pick her up and she crawls away from me, if I forget and I try to pick her up from over here, I hurt so much, because not only is it bad for your back, but I've recently had a baby. So like postpartum core, pelvic floor muscles are working on it. So I find myself so frequently trying to chase after her so that I can scoop her up in a good close as I can get, which is harder to get there, but much easier on my back.
Yes, that is an excellent real life scenario.
You know, we don't always have perfect posture when it comes to mom life, dog life, working from home. You don't have a computer set up because you really didn't expect to be there. But the more we train ourselves to like make it a habit, the less we have to think about it.
All right. I'm going to keep firing away here. You guys got it in you?
Awesome.
Yeah.
All right. I usually have a lot of tension and stiffness in my neck and upper back right when I wake up in the morning, which makes it hard to get out of bed and wake up. I feel you. Yeah. Any morning exercises help you wake up and relieve stiffness in the neck? Could be a fun exercise we do with our patients here.
Really? Rachelle, take it away.
I can take some. So when you wake up with a lot of neck stiffness, it could be a whole bunch of different things. And so we're not going to go into the diagnosis because I don't know your personal history. I don't know what it could be. I'm going to show you guys a good general easy thing you can do in order to relieve a little bit of the neck tension. Typically, you see a lot of people pulling their necks in different directions, which might maybe be okay for you. But honestly, the majority of the people who do those stretches are pulling their heads over their shoulders so much that it just causes your muscles to tighten up more because it's anticipating that you're going to snap your own neck off. And so it's like, no, protect yourself. And then it tightens up and that's not helpful. So I'm going to show you a way that you can very gently stretch through the upper neck and the upper back, because again, all of those muscles from there are connected to one another. It should help a little bit. I'm going to show you, if you've been in yoga class, you've done this before, it's called a cat-cow. We're going to get down on the floor on our hands and knees. If you feel comfortable doing this with me, you feel like you can get down and up from the floor, no problem, without hurting your knees, please do. If you don't have carpet like I do, you can use a rug, you can use a pillow on the floor for your knees, you can use a yoga mat, you can fold up some sweaters and put it on the floor. But let's take a moment, we're all going to come down together. I'm going to show you how to do a cat-cow while focusing on stretching your neck so that you're not overdoing it and hurting yourself. So I'm going to back up a little bit. Can you guys see me well?
You're good.
Okay, so on your hands and knees from here, I think everyone should have had time to come down here by now. Hands are directly below your shoulders, knees are directly below your hips. I want you to allow your belly to reach forward, breastbone to reach forward. Slowly stretch your neck up to the ceiling. You'll feel a little bit of a stretch up in here, maybe a little bit in the belly. And then from there, we're going to curve it around. Your chin goes all the way down to your breastbone. Your back goes up to the ceiling. You scoop under your tailbone so that you're kind of like an upside down U. And that push through the upper back here, I can feel the muscles that connect from my upper back to my neck stretching in a way that feels so awesome because I've been carrying a baby all day and I'm exhausted. That feels great. Oh my God. So we're going to do it again. Arch U up to the ceiling, almost like you're making a letter U this way, and then arch opposite you this way. And as you do it and you gently allow your neck to warm up, I want you to not force yourself through it. You don't need to push all the way. It should be more about repetitions and less about intensity. Because as you do this and you wake up in the morning, your muscles are just getting going. You probably don't have a lot of blood flow in there, and you need blood flow. And you need repetition in order for your muscles to gently do what you want them to do. So once you keep doing this 10, 15, 20, 30 times, whatever feels like it's enough for you, then from there, you can get up, take a breath, feel like you can move around a little bit more, and start your day. And if you don't find that that's enough, and you still need a little bit more specific help, Megan and I can figure out what it is your body needs. So I hope that helps you.
Rachelle, that was awesome. Remember, motion is lotion.
It's
All about just getting moving first thing in the morning. You got to move and it'll lubricate your joints. So just remember, motion is lotion.
It's funny, I said that in the chat feature earlier. Now you know it's real. So we've got a couple of questions about pillows. You know, I personally don't have an arsenal of brands or types that I like, so I'll throw it to you guys. People are asking what types you suggest. They think it's causing neck pain. How can I sleep throughout the night in a relaxed position? So I don't know if you have any pointers on that.
Yeah. Megan, how about you talk, and I'm going to get a bunch of pillows because I'm in a house right now, and I can demonstrate for you.
Perfect. So I'll kind of start off with talking just how I teach people through this. We can check it out together. So, I mean, this kind of is similar to the chair question in that there's no one right answer. It would be so great and so easy if there was one right answer, the perfect pillow that would fix everyone's neck pain. Instead, it's going to vary a little bit based on the person. So the first thing that you're going to want to ask yourself is what position you most commonly sleep in, because that's going to actually dictate kind of the height of the pillow that you want. Usually I recommend something that's kind of in terms of firmness, kind of just medium, but then it's about how thick it is. So I teach people about hills and valleys. So imagine, Rachelle, can you show us how if you're a side sleeper, how you're gonna have a hill and then a pretty big valley that you're gonna need to fill with your pillow?
Oh yeah, here we go. So, good thing I'm in the house right now. Okie dokie. So if I'm a side sleeper and I've got two pillows and I lay down on them.
Perfect. So what we're looking at here is Rachelle's neck. So we're looking at her upper back into her neck. We want to have that nice straight line. So your head stays right in the middle, almost like if you took me and just turned me straight on my side, right? That nice straight line. So Rachelle might actually need, that might be a little bit too low. So Rachelle might actually need something right kind of in between those two. What she wants to do is fill that valley. That looks good. How's that feel?
My favorite pillow. This is the one that fits my noggin.
So this is Rachelle's best pillow because it most naturally contours to fill that space between her head and the bed when she's on her shoulder. So watch what happens with no pillow. Yep, boom. Good. So we want to use just a tall enough pillow to bring your head into neutral. So let's see, if you were a back sleeper, Rachelle, what kind of pillow would we need there? So now we're talking. So now you've got a hill, you've got a valley at your neck, and then you've got another hill in your upper back. So for this one, you're probably going to actually want a little bit shorter pillow if you're a back sleeper.
Yes. Oh.
Yeah, that one's a little bit tall. See how her head is a little bit up. So she may just need one that's a little bit smaller if she is a back sleeper. Not too bad though. Yeah. It looks pretty good. I think you could do that, or even just a teeny bit softer. Yeah, that looks pretty good. How's that feel?
That's pretty good, actually.
Okay, you're gonna take a nap.
I'm a pillow hoarder, and I have one pillow that I sleep on when I start, and a different pillow on the side of the bed. So when I wake up in the middle of the night and I feel like my neck hurts, I switch out the pillows and I turn a different way.
Yep, that's great. Again, it's that idea of just kind of giving your body the ability to change your postures. But so again, when you're picking a pillow, those are kind of the things that you're thinking about. Pick your sleeping position. We recommend side or back, just because notice as Rachelle's sleeping on her belly, you'll notice that her head is turned completely to one side in order to breathe. So I like to liken it to if I were to ask someone to sit there and then turn their head to the side and leave it there for 8 hours, how they think their neck would feel at the end of that. Probably not so great. So not really good. So sleeping on your belly is actually is pretty tough for your neck if you're having neck issues. So we do recommend, if you can, get onto your side or on your back, fill those valleys, and that's going to be your most comfortable option.
Now I'm not going to get up.
Someone's asking for the pillow for side sleepers. Can you provide the name?
You know, I don't give people a specific name. Rachelle, do you have a? Oh, you got.
I don't have a name because different brands are different sizes. So like it depends on how thick you need it to be. But personally, there's so many different types. I use for my neck that hurts a lot, a pillow that's generally shaped like this. So you see how it's got one little bump and then it goes down and then it comes up. So essentially your head fits in that valley and the bump sits in your neck. So depending on where you're sleeping, when I sleep on my back and I need something shorter, I use the tiny bump for me because this fits my neck. When I'm sleeping on my side and I want something higher, I use the side bump because the side bump, which is taller, fits between my shoulder and my neck. Now I'm a small person, so my shoulders are smaller than the typical person's might be. So this is what works for me so that I don't have to have 100 pillows around me like I really want to, but my husband says that they get in the way. But I suggest trying what works for you. Sometimes different stores have generous return policies. I would just make sure that you don't totally mess up the pillow before you bring it back if it doesn't work well for you, and clean it because, yeah.
All right, we got another one here. This is more mid-back. So do you have any tips for chronic pain in the rhomboids? For our viewers who don't know what the rhomboids are, they're muscles in the middle of your back between your shoulder blades. This person's been rolling on tennis balls for some muscle release, which has provided some temporary relief. Yoga also helps, but is only temporary fix. Any insight would be much appreciated. Thanks.
I can take that one. Great question. And I think that pesky rhomboid pain is something that a lot of us can relate to. I know I've had it come and go at different times. Honestly, would love to have the opportunity to talk to you more about that and your exact case, because there's actually several different things that can cause kind of that upper back pain. Sometimes it's the muscles themselves, sometimes it's stiffness in the joints in your upper back. So doing the mobility exercises that Rachelle showed us, so those backwards bends, the cat-cow, sometimes that stuff can be helpful. But it is worth, if it's been sticking around for a while, it's worth getting it evaluated by a physical therapist, because sometimes too, if you actually have something in your neck that's irritated, your body sometimes perceives that pain as being down here. So you may be rolling away on a rhomboid and you just can't get it to relax. But sometimes it's actually because something is irritated in your neck, and then we're able to help resolve, kind of get to the root of the actual problem. So Rachelle, I don't know if you have anything you like to add, but that one might take a little bit more specific digging to figure out what's actually causing that and why won't it go away.
Yeah, when I think of that type of pain, which is not like a usual postural thing that people get from our typical rounded shoulder forward head thing, my thought is that there might be something you're doing throughout the day without realizing it that's causing you to use those muscles more than you should. Sometimes, for example, people who have been to a lecture like this and they're like, wow, I should do scap squeezes and sit up really straight, overdo it to the point where you're squeezing so much and you're sitting up so tall and you're basically like military man trying to be as tall as you can for so long that you're overdoing it too much in the opposite direction, and that just causes the spasms and it's just not comfortable either. So if that's you, bring it back a little bit. We want natural fluid motion. If that's not you and you still aren't sure what it's coming from, I think it would be worth thinking about through your day when it is you start to feel that pain, so we can start to pick out what's causing it and then how to relieve it, because we can relieve it as much as you want, but if you keep causing it unintentionally with something in your habits that you're doing, you're not going to get too far.
All right, I've got two questions somewhat interrelated but about the jaw, so I'm going to put them together. One person wants to know if the way I sit at my desk, can that or the way I sleep, can that make my jaw hurt? So that's number one. And the other one was, what about opening your jaw wide and holding a second or two to stretch out the joint to help relax the muscles? I tend to be a tooth grinder while I sleep, and it seems to release the jaw, but maybe there is another exercise or stretch that I can be doing. So another stretch for this person, and also people want to know if their neck, or excuse me, their jaw can be impacted by the way they sleep or sit at their desk.
Yeah, let's talk first about why our jaws are getting tight. A big cause of it is grinding, clenching, poor posture where you're forward like this. When you're more forward, for example, and you're sitting, sit forward with me. Naturally, these muscles in your neck would pull your jaw open in this position. But of course, you're not going to sit with your mouth open all day, because no, your flies are going to fly in. And so we close our mouths in order to do that. But because we're just even a little bit clenching more than we should to keep our mouth closed in this position, that all day, all week, and for many years hurts a lot. Plus the fact that we are all experiencing a global level of anxiety right now, and anxiety responses in a lot of people, myself included, include clenching, sometimes grinding at night, raising your shoulders, cause a lot of pain up and through here. So there's so many reasons why that could happen. So you kind of need to self-assess through your day. When am I feeling pain? When am I feeling grinding? If it's while you're at your computer, maybe you're forward a lot and you're doing that little clench I was telling you about. Maybe I actually did this with a patient today. Shout out to my patient who's going to see me demonstrate this. I caught her talking to me like this, which is fine, except the next day when she was doing a thing with me, she was talking to me like this. And the third session we did, she was talking to me like this. And I said, do you sit like this all the time? Because she's actually putting a lot of pressure on her jaw. And at the moment, you don't feel it. But again, if you do it all day, all week, for multiple years, plus all of the other external factors that are causing us to grind, it's a habit change that you can take over and change for yourself. So evaluate for yourself. Are you clenching? Are you pushing? Do you only sleep on one side when you're sleeping at night? Are you sleeping with your head twisted on your belly all the time? See where it is that you're more frequently feeling that pain, and from there you can kind of start to figure out where the root of it was. Now, in order to stretch it, I don't personally like the open your mouth really, really wide and try to be really big, because I find that if your muscles are already tight and you try to force your way through them with a wide open mouth, you're more likely going to quickly stretch the muscles so much that your body again will think that you're in danger, about to hurt yourself, and so it will tense them up reactively again. So you're kind of fighting against your own body's mechanisms of protecting yourself while trying to relieve pain. Instead, what I like to do is to massage the muscles of your mouth and face And right now, of course, I can't touch you to do that for you and teach you how to do it, but I've actually had a lot of success in telehealth, teaching my patients how to wash their hands, put on gloves if they need to, and get inside of the muscles of your own face and jaw so that you can self-massage it for you. And there's so many different techniques depending on what you want. I'm going to put on a glove so I can kind of show you on myself. There's so many different muscles that we don't have time to go into right now, but if I can help you walk through how to do it for yourself, or if you're just in the shower and things are clean and you feel like you need to kind of play around with it, please don't be aggressive. You have to be very gentle with this, but you can massage the muscles inside your mouth that control how you move. So I have on a glove. I'm going to put this in and kind of massage gently from the back of my cheek to the front. This is something pretty gentle. Most people could do. If your hands are already clean, you can follow with me. Thumb in your mouth. You're going to clench along your cheek. You're going to pull from the back of your cheek to the front. And what you're doing is these muscles that are the cheek muscles are actually muscles that are supposed to clench your jaw together so that you can chew and talk and bite. And you're just gently massaging it from both sides so that after you've done that 5-10 times, hopefully you feel a little bit more relief.
Awesome. Thank you, Rachelle. Woo! I know we didn't get to every question, and I apologize for that. That said, if you're a previous patient of ours, you likely have a therapist that you've worked with in the past. Please don't hesitate to reach out to them via email or phone, or you can simply reach out to any one of our offices and schedule a virtual visit, a telehealth visit. Most insurance companies are waiving your expense related to that anyway. And even if it's just to set up one initial visit for a consultation to get some of your questions answered, that's also fine, but you can likely benefit from some therapy to address your issue as well. We all hope that you have, took some value out of today's talk. We are an orthopedic outpatient physical therapy practice that see an array of conditions from head to toe. So should you feel the need, please don't hesitate to reach out. If you have any concerns from today's session, if you were in pain, please reach out to us. You have some contact information here. We'll be happy to field those questions personally and make sure that everything is okay. You're likely fine, but we want to be careful and make sure that that's the case. That's all we have for today. We hope you enjoyed it. We do have a series of these on a weekly basis, so please stay tuned to your email and join us on our next webinar. And we look forward to seeing you. Be well during these challenging times and take care. Pleasure.
Thanks, everyone.
Everyone.
Bye, Megan. Bye, Mir.
Bye, Mir.
Miss you guys.